Today we're diving into what one source calls a critical public health emergency. We're talking about a mental health crisis that is unfolding almost completely in silence across the Indian state of Meghalaya.
And the source material we're breaking down today doesn't pull any punches. It doesn't just call this a problem, it calls it a silent epidemic. A crisis that's not just being overlooked by authorities, but one that is
costing lives and destroying families. And that's really the heart of it, isn't it? This isn't some abstract policy debate. It's a crisis with a real devastating human impact, and it's happening every single day.
Which, of course, brings us to the central question we're going to explore. How can a crisis of this magnitude happen in silence?
All right, so let's get into it. First things first, what does the source actually mean when they use that phrase, a silent epidemic?
Well, it's called silent for two really big reasons. First, you've got this powerful social stigma that prevents people from speaking out about what they're going through. And second, there's a serious lack of official data, which means the government isn't even really tracking the scale of the problem. You put those two things together, and you get the perfect conditions for a crisis to grow, completely in the shadows.
The source argues that this whole situation is being fueled by three deeply interconnected challenges. So let's unpack them one by one.
First up, and this is just heartbreaking, we're seeing tragically high rates of suicide and depression. What's particularly alarming, according to the source, is that this is hitting the state's youth the hardest.
Second, there's the issue of widespread substance abuse, and the source is crystal clear on this point. This is not a separate issue. It's often a direct consequence of, and a major contributor to, the underlying mental health crisis. And third, it all comes back to that powerful social stigma. It basically builds a wall of silence around people, trapping them and making them feel like they have to suffer all alone, without ever reaching out for help.
So just think about what happens when you combine those three challenges. You have individuals in deep crisis, and when they look for help, they turn to a healthcare system that the source describes as crumbling and completely unprepared. The result? The very community support systems that should be there to catch them are broken, leaving people with absolutely nowhere to turn.
But here's where it gets really interesting. The source argues that what's truly at the root of all this inaction is something you might not expect, an information void, a fundamental lack of official data and transparency.
The argument is simple but incredibly powerful. You cannot fight a crisis that you refuse to measure. Without accurate data, any attempt to fix the problem is really just guesswork.
This lack of data leads to some really fundamental questions. First and foremost, what is the actual suicide rate in Meghalaya? The source argues there are simply no clear public numbers.
Next up, how many facilities and trained professionals are actually available to help people? The source claims the number of psychiatrists is shockingly low and is demanding that the government just release the official numbers.
And finally, what's the plan here? Is there a real, comprehensive strategy for addressing substance abuse? Or is the approach just about punishment without getting to any of the root causes?
And this slide just captures the core argument perfectly. The source contrasts the current approach, which is focused on punitive measures, with a holistic one that's all about community healing. It's a call to shift from just punishing the symptoms to actually treating the disease.
So if the system isn't responding, where does the solution come from? Well, the source argues that the path forward has to be citizen-led.
And it doesn't just identify the problem, it actually proposes a clear 5-step action plan. It starts with demanding a real funded government policy. From there, it calls for practical steps like integrating mental health care into primary clinics and pushing for mental health education in schools. The whole plan is about building a system of support from the ground up, using every tool available.
So the ultimate goal here is a total transformation. It's about moving people from a state of silent suffering to becoming a community that's taking empowered collective action.
And so, we're left with this final powerful question. When a crisis is silent, who is responsible for making it heard? The source's answer is clear. The responsibility doesn't just lie with the government, it lies with everyone. To speak up, to demand action, and to finally break the silence.